All right, so we're moving on to residual limb care and amputee athletes, and I'm going to start off by referring back to Nick's talk. And Nick showed you when he dealt with track and field athletes that there were quite a lot of injuries with respect to individuals who are limb deficient. And at first, we were quite surprised by that. We thought that the athletes who were wheelchair users were going to have the majority of the injuries. And then we saw that actually this group of athletes who have limb deficiency and have residual stumps have a lot of problems. And what I'm going to show you is not only about the injuries, but we're going to talk about some of the medical conditions as well. So I show you this picture because this is the South African group of Paralympic athletes that I've looked after for since 2008. And regardless if they are swimmers, track and field athletes, whatever the discipline, every single one of them have had some kind of a stump issue in my care. And there's some of them who are serial stump issue people. They have stump issues every single year. And I want to try and explain some of these. But the first point of departure in this is that this is an area where the sports physician can't work in isolation. The physiotherapist can't work in isolation, and the coach can't work in isolation. If there's ever a setting where the multidisciplinary team have to work together, this is it. So we need our prosthetist to actually be perhaps the most important person in the team when it comes to working with the residuum of the leg. And why this is the case is going to be apparent in just a moment. But I was preparing today for a group of medical people who perhaps had no experience, prior experience in prosthetics and people who are limb deficient. So let me just start at the beginning and say that a prosthesis is made up of a socket that surrounds a residual limb, and it has a terminal device. A terminal device could either be a hand or a foot. And then there's an apparatus to connect and adjust the position of the socket relative to that terminal device. The socket is perhaps the most important part because that is what is custom made. Now, just let's stop there for a moment because this is not the case in all individuals who've lost a limb, that the socket is custom made. For example, if I show you a picture from Angola in Africa, here we have some prosthetic limbs that you can pick the one that most suits you, and that is the one that is used. So maybe just something to bear in mind, that it's a luxury actually to have a socket that is customized to the individual. So the terminal apparatus, whether that's a foot or a hand, that is custom made, commercially obtained, and there are many companies that actually produce those. And sometimes, more often than not, you will find that an individual has two different types of prosthetics. There's one for everyday use, and then there's one which is a sport prosthesis as well. And that's important to remember because often you'll find that there's a problem, and what do? We go to look at the sport prosthesis because those are when we're actually looking at the peak forces that are going through the stump socket. But it's often the everyday ones where there might not be as high forces, but the forces are chronic over time, and there might be a problem there that actually needs to be addressed. So these are the main components, as I've said, the foot, the knee in this instance, the shafts, and then this here is the interface, which is the stump socket interface. And this itself is divided into different components. There's the frame, which is the outside, and then there is a liner. A liner can be polyurethane or silicone. In some instances, one can have a sock. And then there's a suspension system, and a suspension system is really what is responsible for keeping the stump attached to that socket. And that can either be through a pin, or it can, in more old-fashioned harnesses, old-fashioned sockets, it can be a belt with a harness. But these days, the state of the art is suction valves, or osseous integrated prosthesis, where the prosthesis actually is drilled into the bone. So these liners and socks, or the liners rather, are very important, and I will show you why in just a while. In fact, if one looks at this particular slide, it shows a liner, and it shows the importance of the liner. I was very interested to note that when I went to go visit a prosthetic factory in Iceland, they allowed this group of scientists and doctors to actually go through the entire factory and actually see how the prosthetics were made, but you were not allowed into the liner area. So the liner technology is what is protected as very proprietary. And when I show you the slide on the money side of this, you'll actually see why. So your liner is there to reduce your pressure peaks. So it has some function to actually reduce those pressures. It's to absorb your shear forces, which are the forces that actually work against the skin, and it's to improve your suspension, to reduce your soft tissue displacement, and you can also get some liners which are impregnated with certain agents, and those ingredients are dispersed via the liners through to the skin. So this is big business, and if you have a look at these costs here, non-automated, sport-specific prosthesis alone could cost up to $15,000, and this has probably escalated in the last 4 years since I made the slide. They have a 2-year lifespan under heavy athletic use, so you can see how often people are going to need to change it. The protective sleeves of the residual limb can add another $1,500 per year, and depending on the level of training that's necessary for a patient to return to sport, rehabilitation, all of these things could cost another $5,000 to $15,000 in the first year, and then $2,000 to $5,000 annually. Then, because I told you that the problems with the stump occur, you can add imaging to that, and you can see you start to build quite a lot of money here. So the cost of maintaining a sports prosthesis and being in a competitive athletic environment can cost between $20,000 to $35,000 per year. But this is the most important slide that I'm going to show you, and to understand why there are problems, you need to understand this particular slide. So here you have a socket, and we know that the stump fits in to the socket. So this area here is the interface between the human being and the technology that they're going to be using. This interface transmits the forces from the ground, the equal but opposite forces that are going from the ground in reaction through to the human being again, and that results, these forces, in the forward motion. So these load stress cycles are placed through a relatively hard interface, and these are hard interfaces. In fact, I saw a soft socket for the first time the other day, so they are changing, but this is a relatively hard interface on the skin and soft tissue. Now remember that somebody who's putting their leg into this socket, that piece of skin at the bottom of the stump becomes the sole of the foot. And the skin here is totally different to the sole of the foot. So that is why, one of the reasons why you're actually getting problems in this area. The skin is not the final barrier. The liner is, therefore this liner is enclosing the skin in a strange environment. The body is not used to this environment. We know that the biomechanics of somebody who's using a stump socket interface is abnormal. The altered center of gravity places abnormal forces going through there. Then the environment of the stump in this area, the air pressure is different. The temperature, the humidity is abnormal. It's not meant to, the skin's not meant to be placed in those environments. And the volume of the stump changes. Now remember, I spoke about flying. One of the things that flying does to a stump is it makes it swell. And you can get up to a 20% difference in the volume fluctuation of a stump. So for example, if you don't watch out and you don't remove the prosthesis while you're actually flying, you can actually find that when you actually start to get the stump into the prosthesis and into the socket, when you get to your destination, you have to force it. And now you're going to get areas that are in contact that are not meant to be in contact with that specific area, and you can get skin breakdown happening. So the first important thing that if you're flying with athletes who have residual stumps, get them to leave the liner on or put a compression bandage over the stump while they're flying. So what happens then is you start restricting the amount of swelling of that stump, and that will actually lead to a better prognosis. So when the volume of the stump changes, that alters the biomechanic interface with altered pressure distribution. So this is in our biomechanics laboratory and one of our T44 athletes. And what I want to show you here is we often take for granted that, okay, if this person has got a limb deficiency and they're going to be having this stump socket and they're going to have the amputation on this side, this is where we're going to have all the problems. And what I want to show you is that is far from the truth. Many people who have a limb deficiency actually have a lot of the problems on the sound side. And why does that occur? This is a force plate that this particular athlete is running on. And you can see that here they're hitting the force plate with the prosthetic limb, with the blade. Here are the forces that are generated. So it's about 2,000 newtons. And here, once he's passed through, once he's hit that force plate with the sound side, more than double the forces are registered on the sound side. So we find that there's a sparing on the prosthetic side and an increased transfer of forces to the other side. So you could get a single below-knee amputee having these problems due to the altered center of gravity on the sound side. In this particular individual, had a medial tibial stress syndrome on the sound leg, overloading of the contralateral facet of L5, and even working through our slings, he had a shoulder problem on the contralateral side as well. So one has to bear all of these things in mind, and perhaps we start to understand why we start getting so many acute chronic injuries in the population who are limb deficient. And this just shows you again, here's our athlete that I spoke about. He's in a aeroplane seat. You can see he's a tall individual, but far too little space here. And this is the kind of problems that happen. There's certain areas that we know specific to this stump that tend to swell when he flies. Right, so what happens to the skin in this environment? We know that the skin's there for many important things: temperature regulation, excretion, sensation. We know that when you have an amputation, the skin condition changes. We know that there's reduced sensation in that skin. What does that mean? That you don't know when you've hurt that area. So often they can report late, the environment is abnormal, and here you have that difference between the sole of the foot and the popliteal fossa, which literally becomes your sole. So when we look at the irritants, we know that there are extrinsic issues that can irritate the skin. There are intrinsic. There's a mechanical, hydration, chemical, bacterial, heat and thermal, radiation issues. They all are factors that can actually alter or irritate the skin. Then they're intrinsic. We know that this area of the skin is susceptible to allergy because it's in contact with foreign things, and there are certain disease states. So the big take-home message that I want to give you is that skin lesions that occur on a stump, however small they are very, very important, because they can just accelerate into an excessive disorder, time off the prosthesis, onto crutches and out of competition. And that's not what we want. So anything minor that happens on a residual limb is a potential danger. So what are the important things? Treat early, continued vigilance, keep watching that stump every day, and know that skin lesions don't heal on their own accord. That wait and watch phenomenon is not good in this setting. We like to treat these early, but most important, what I've learned over the years is don't use needles. My initial instinct was, if there's anything wrong with the skin and they could see any evidence of pus, put in a needle and drain it. This is not the place to do that, because that will be like inducing a stress fracture. Always say that a skin break in somebody who has a stump is like having a stress fracture. It's going to take a long time to heal. So Have a look. I mean, I'm sure that these slides are going to be made available to you. I haven't got time to go into there in very much detail. But we know that inadequate washing, sweating in gym, not cleaning afterwards, all of those things are high risk factors for stump problems. Smoking. If we have any athletes that actually smoke still, they're amputees, that makes a high risk for stump problems as well. And my biggest friend is Bactroban or Miripressine, which is something that actually I go with a lot and use it. Now, there's some conditions with the stump that actually look worse than they are. This is stump edema syndrome. You would think that this is infection, but it isn't. This is somebody who just has forced this stump into the socket after flying, and they've got stump edema. And if one treats that conservatively, it will go away. Now, I thought I'd just show you this. This is one of my athletes. Here I am. I don't usually, I'm not horrible to my athletes. You see, I don't usually do this. This is a mocked up picture, you see. And here's Eva laughing at me, you see. Now, what's the story here? Now, we have Otto Bock, who is with us here. And Otto Bock provide a wonderful service. And they go and they fix all of these stumps and these sockets for free. But the problem is, and particularly coming from a country where not everybody has got access to these wonderful things that we take for granted, a lot of the athletes will go directly to Otto Bock as they arrive there to get a new socket or a new flashy liner, and they make that critical error of doing something new in competition. And this is what Ahmad did here. Ahmad ignored all my warnings, and he went to have a brand new socket made with the South African flag printed on it, and 2 days later he couldn't move. So we also know what Nick showed us about that a lot of the amputee athletes get into the village, they walk too much, so I'm not going to spend much time on that. I just want to give you another message. These small little lesions that you see whenever there's any time of any breakdown, so this superficial erosion, treat this as a stress fracture in evolution. Yes, you can get your contact dermatitis. As anything else that you can get on your normal hands, you're going to have an increased chance in this area because of the materials that are used. There's non-specific eczema that can be weeping as well, that you need to actually go and expose this to the dry air. Here we have these little epidermoid cysts as well. These little epidermoid cysts are perhaps one of your first indicators that you're having a fitting problem with your socket. So one takes care of these by actually sending the patient early back to the prosthetist to actually have these sorted out. This is infection. When you see this shiny skin with underlying warm skin, we know that those are important, and those need not local antibiotic. These need IV infusions, admissions. We get that sorted out as quickly as possible. On a person who is got 2 or 4 functioning limbs, these little skin tags I would lop off without any problem. If you do that in an amputee athlete, in the area of the residual, you will induce a stress fracture and that athlete will be out. So leave these skin tags alone, particularly around the time of competition. Just know that there are horrible things that can happen in a residual stump. There can be a squamous cell carcinoma that can occur. This, which looks like warts, isn't necessarily warts. Don't assume that that is warty. Those are from pressure gradients that happen and form like that over time. Know that there are also issues to do with bad amputations where there's not enough skin that actually occurs or soft tissue under the stump. You can see that those are problematic. So your plain film x-rays can help you. Low dose x-rays are also worthwhile in actually showing how snugly your socket fits. That's a good fitting socket. This is a poor fitting socket where there's area and space below. So that's got value. And of course, the gold standard with these stump problems is MRI, particularly with stump pain. This is an athlete here who has dual pathology. We thought that the problem causing the pain here was this bursa, this substumpal bursitis that is here, but this was more than that. Look at this neuroma that has formed over here as well along the nerve. And there are various different imaging formats that we can use. This is an ultrasound where we can see the neuroma, but that's a transverse section where one can see the neuroma in that area as well. What do we do with stump pain? These are the first-line treatment is physiotherapy and massage. Then one can use interferential and ultrasound, and then a stepwise approach to the painful stump, particularly if there is a neuroma. We go through paracetamol, tramadol, and remember that these neuromas have a neurogenic origin of the pain, so amitriptyline, gabapentin, and pregabalin are also worthwhile. In this particular individual that I've showed you before, none of these worked, and we had to use sclerosing injections around the neuroma to actually get it sorted out. So, finally, this is the area where biology meets technology. Every human being is different. Every stump is different. They have their own unique problems. It's a dynamic challenge. It has to be assessed daily. The problems are complex. There's no one size that fits all. Get the whole team working on this. Your prosthetist is most important. Think out of the box. Remember that we know this. Take-home message. Every physical problem has a complex emotional component to it. And most importantly, don't mess with the stump. Okay? No needles. Leave the stump alone.